Hi, you guys. Welcome back for our daily practice questions. It is day 131, and we're doing a little twist. We're now heading into our Pharm series. So, I wanted to go back over because we've navigated through all of the systems so far this year, these past 130 days. So, now I want to take you a little bit deeper through each of the systems and hit the Pharm of it because I get a lot of questions on the pharmacology, and I always tell y'all to study it by the system so it's not a separate area to cover. Study it as you're reviewing that area, looking at first line, second line, etc. So we're going to work through those and hit those most common diagnoses and their treatments and alternate treatment options so that y'all can learn how to apply that as well, okay? But as always, y'all know I like to get into my introductions and disclaimer before getting started with our questions for today. So for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I'm a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more. And they're all linked in the bio of this channel. Now, I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. I have maintained a 99% pass rate on all of my courses and a 100% pass rate on my one-on-one sessions. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I've designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. And don't forget to hit the subscribe button so you don't miss any notifications of my new videos. Question number 1 states, what is the recommended first-line treatment for uncomplicated bacterial otitis externa in adults? Is it A, oral amoxicillin? Is it B, systemic corticosteroids? Is it C, topical antibiotics and corticosteroid eardrops? Or is it D, antifungal eardrops? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem is the question is the stem. But I'm trying to get you on a knowledge base, and then we'll go deeper into the application style of these questions. You if you've been following a little bit, you know how I go through these styles so that you can understand from a knowledge perspective and then go deeper. So follow me. So it says, what is the recommended first-line treatment for uncomplicated bacterial otitis externa in adults? And your best answer is C. We're going to give them a topical antibiotic and corticosteroid eardrop. So commonly you'll see like your Cipro, and like a cortisone drop for the ears, and that is to cover the bacteria as well as the inflammation, okay? Question number 2, which condition is a contraindication for using topical eardrops in a patient with otitis externa? Is it A, erythema of the outer ear? Is it B, diabetes? Is it C, tympanic membrane perforation? Or is it D, a history of recurrent swimmer's ear? Take a moment and tell me what you got in the comments, y'all. All right, again, stem is the question is the stem, and it states, which condition is a contraindication for using topical eardrops in a patient with otitis externa? And it will be C, tympanic membrane perforation. Because some of those drops can have ototoxicity as a side effect, you don't want to start adding drops into a perforated tympanic membrane in that ear canal, right? So that is a contraindication. So you're always wanting to assess and look at that tympanic membrane, as you're prescribing and treating patients with ear pain, ear infections, etc. And remember, the way our classic identifier for otitis externa is the complaint of tragal pain. Remember that tragus is on the outer portion of the ear, the external portion. So otitis externa, they typically have tragal pain. Okay. All right, lastly, question number 3. In addition to topical treatment, what is an appropriate recommendation for managing pain in a patient with acute otitis externa? Is it A, prescribe opioid analgesics for 7 days? Is it B, recommend acetaminophen or NSAIDs for pain control? Is it C, apply warm compresses only and avoid all medications? Or is it D, to use systemic steroids to reduce inflammation and pain? Take a moment and tell me what you got in the comments, y'all. All right. And so it states, in addition to topical treatment, what is an appropriate recommendation for managing the pain in a patient with acute otitis externa? And your best answer is B. You can recommend your Tylenols, your NSAIDs for pain control. We want to give that antibiotic and corticosteroid drops so that that can treat the source of the issue and kill the infection while reducing the inflammation. But that pain can be very severe. And so for symptomatic management, you can also give them acetaminophen, aka Tylenol, or an NSAID, like your ibuprofens. Okay. All right, you guys. I hope you found this helpful. Like I said, we are hitting our Pharm series because I want to make sure that you are really understanding these medications. And as we go deeper, you'll see how we'll be pivoting through these. Uh, I hope you found it helpful. Be sure to like, comment, and subscribe, and share with whomever you may think may find this beneficial as well. But make sure you are locked in so you're not missing this series. I think this is going to be very beneficial for you guys because we're going to start hitting it by system, but also so that you're able to understand the drug class and its contraindications and more. All right. And as always, if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. Again, everything that I offer is linked in the bio of this channel. But as always, if you're looking to book any of my one-on-one sessions, any of my custom packages or plans, or any of my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.